Go.
Hello, I'm Emma Stockman. I'm a student nurse with Sam Houston State University, and I'm going to be doing some functional assessments for Miss Mona Corey. Would you like to introduce yourself?
Yes, my name is Mona Corey. I'm 85 years old and thank God I'm very healthy.
Yes. So first off, we're going to be doing the mini cognition test. So I'm going to ask you to memorize 3 words.
Yes.
And try to keep them in your brain. So let's see here. Remember, village, kitchen.
Bridge.
Okay, let's try a different one then. River, nation,
Nation.
and finger.
Big finger.
Yes. Okay. Now,
What's the first one?
I can't tell you them again.
Bridge.
That
River.
was, yeah, okay, keep it in your mind.
Yeah, because in the beginning you said bridge.
That was a different one, but yes. Alrighty, so I'm gonna have you draw a clock now from the best of your memory and abilities. And I want you to put the hands on 10:30 p.m. or I guess p.m. a.m. doesn't really matter here.
12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. It's not very even.
All right, and then put it on 10:30. The hands on 10:30. Wonderful. Now, what were those 3 items, things I told you to remember?
River,
Good.
bridge.
No.
I forgot.
Can you think of the last one?
No.
Alrighty. Thank you. Alright, so next we're going to be doing the geriatric depression scale. I'm going to ask you a series of questions and you will simply answer yes or no. You ready?
I just thought, speak louder,
You want me to speak louder?
a little bit.
Yes, ma'am. Alright, so are you basically satisfied with your life?
No.
Alright. Have you dropped many of your activities and interests?
Yes.
Do you feel that your life is empty?
No.
How often do you get bored?
Very often nowadays.
Okay, so yes. Are you in good spirits most of the time?
Yes.
Are you afraid that something bad is going to happen to you?
No.
Do you feel happy most of the time?
Yes.
How often do you feel helpless?
Not often.
Okay. Do you prefer to stay at home rather than going out and doing new things?
I go out.
You go out. Do you feel you have more problems with memory than most?
Lately, yes.
Okay. Do you think that it is wonderful to be alive now?
Yes.
That is good to hear. Do you feel pretty worthless the way you are now?
No.
Do you feel full of energy?
Yes.
It's very good. Do you feel that your situation is hopeless?
Do I have to explain?
You can explain.
With my husband, it's hopeless.
with him? Does that make you feel
Hopeless.
okay? Do you think that most people are better off than you are?
Not necessarily, no.
Okay. All right, that concludes this assessment. Thank you.
Thank you.
Okay, so next I'm going to be doing the Hendrick Fall Risk Assessment. So, what is your name
Mona
and your last name?
Corey,
What is your date of birth
5/17/1936.
and what year is it?
Now,
Yes.
2021.
Awesome. And where are you?
I am at my granddaughter's house.
Awesome. So she is oriented ×4. The next thing on the Hendrick Fall Risk Assessment is depression. Have you been medically diagnosed with depression?
Sometime, yes.
Okay. And next is altered elimination. Do you have any problems with incontinence, frequency, urgency, or diarrhea?
No.
No? Okay. Amazing. Next, I'm going to have you get up, and I'll have you just walk in a little straight line so I can assess your gait and your ambulation.
Do that?
So yes, we can do the get up and go test while doing this. So the get up and go test, you'll place your hands there and you'll just get up. Great. And then I'll have you walk in a straight line over here, assessing her gait, and then I'll have you come back to your seat here. Alrighty. Next one here, I have several questions to ask of you. Do you take any anti-epileptics?
No.
These are medications that help with seizures.
No.
Okay. Do you take any benzodiazepines like alprazolam, which is Xanax, clonazepam, diazepam? Do you take any of these?
I take sleeping pill.
Do you know the name of it?
No.
No? Okay. Could it possibly be midazolam, lorazepam? None of those ring a bell?
No. But it's a,
It's a benzodiazepine?
Yes.
Okay. Alrighty. Thank you. Next, I'm going to be using the CATS Index of Independence and Activities of Daily Living. I'm going to ask you a couple questions. Are you able to bathe or shower yourself completely?
Yes.
Every body part, such as back, genitals,
Yes.
and extremities?
Yes.
Okay. Are you able to get clothes from your closet and drawers and put them on yourself?
Yes.
Are you able to put on your shoes as well without assistance?
Yes.
Okay. Are you able to get on and off the toilet and clean your genital area without help and pull your clothes back on?
Yes.
Okay. Are you able to move in and out of bed or a chair unassisted? Or do you need any mechanical aid to help you?
I can do it by myself, but for safety in the morning, I use walker.
Okay. Are you able to completely have self-control over urination and going number 2?
Yes.
Yes? Okay. And are you able to get your food from the plate into your mouth without any help? And
Yes.
are you able to prepare the food?
Yes.
Amazing. All right, I'm going to continue, and we're going to do the next assessment called spices. Do you have any disturbances in your sleeping patterns?
Yes.
Okay. Do you have problems with eating and feeding?
I don't have a lot of appetite.
Not a lot of appetite. But are you able to eat about 90 to 100% of your food?
Yes.
Yes? Okay. And do you have any problems with incontinence? It's kind of repetitive, but we'll keep going. So you don't have any problems with urinating and defecating?
No.
Okay. And or do you ever get confused at times or unable to remember something?
No.
Okay. Have you fallen?
Yes.
How many times?
Twice.
Twice in the past 3 years?
6 years.
6 years, okay. And do you notice any of your skin breaking down or getting really dry and flaky and cracked?
Yes.
You do? In what areas?
My heels.
Your heels. Okay, thank you. All right, so we have finished your functional assessment. Now I'm going to ask you about your future. And so let me start with, what is the perception of the quality of your life?
I don't understand the question.
Okay, so what is your perception of the quality of your life? How do you view your life right now?
Thank God it's not worse.
Yes. Can you elaborate?
I am better off than many people my age, health-wise, and not enough people to love.
Not enough people to love? Oh. Now let me ask, what are some of the goals you have? These can be short-term, long-term goals, whatever.
My goal is to stay healthy and alert and enjoy my grandchildren and see them successful.
All right. I will make sure that happens. So now I'm going to go over some of the concerns I have for you since we did go through all of these assessments. I did notice that you have a slight chance of depression, and I'm going to follow up with this. And then also, you told me about your history of falls, and so I want to follow up on this as well. So for your falls, this happens a lot in older adults because of several things. We have visual disturbances. This could just be like eyesight issues or complete blindness. And we also have vestibular problems that can affect your balance. And of course, weakness in the legs and sensory perception also lead to falls. And so I want to talk about some teaching points that I can help you with to maybe improve your balance and avoid falls, because we don't want that. So you are taking blood pressure medications, correct?
Yes.
A lot of these can result in something called orthostatic hypotension. And this is when you get up, you feel really dizzy, and this can lead to falls. So what I want you to do is, instead of getting up all in one motion really fast, which could make you lightheaded, take your time. Sit up, take a minute to breathe and gain your balance, and then kind of move in each step, making sure that you have full balance each time. Take your time with this. Next off is your visual disturbances. You wear glasses, and she had told me before that one of her falls occurred in the dark. And so what I want to teach her about this is make sure when it's nighttime or any time in your house, make sure the lights are on, that there's no rugs on the ground that you could trip and fall over. Make sure there's no cords around anywhere. Make sure that when you're walking, the path is clear. And you did tell me that you have a walker, and that would be of great use at nighttime or when you first wake up. If your legs are feeling a little weaker, that is a great thing to use. Lastly, she has a history of osteoporosis, and I bring this up because this makes falls more dangerous. You definitely have a higher chance of breaking a bone if you do fall. And so with this, I have one resource for you. I can refer you to a dietitian, and this way they will go over what your calcium and vitamin D intake have to be, because this can help with your bone strength. My next concern for you is we went over the geriatric depression scale, and it does show a little bit of depression. With this, depression is often underdiagnosed in older adults because a lot of healthcare providers will confuse this as a manifestation or a sign of dementia. But often this is not the case. Depression is very common in older adults. And so what I want to explain to you are some things that could be causing your depression and some things that we could use to help you out with it. And so you did tell me earlier in one of the assessments that you are your primary caregiver for your husband. Now this can cause a caregiver role problem or conflict. It can cause a lot of stress on you. It can cause you to stay isolated and be less social with others. And so my teaching points with this is to maybe have a caregiver from a home care agency help out with the care you provide for your husband. And it would be really amazing if you could seek out several other senior citizens and get together and do some activities. There's many activities out there that senior citizens can do. And you do take an antidepressant. It is very important that you adhere to that medication, take it at the same time every day, and do not skip doses because it has to stay at a certain level in your body. So my one resource that I'm going to provide to you is seek out a home health care agency that offers respite care. This way you can take a break from all caregiving duties. You can spend time with your grandchildren, you can go shopping with friends, you can do whatever you want, and that caregiver role will cease to exist in that amount of time. That will give you a break and hopefully help with some of the depression symptoms that you have. And yes, do you have any questions or concerns for me?
No, thank you.
All right.
And you've been very helpful.
Thank you.
Thank you.
So I've learned in the experience of interviewing my grandmother is that depression is still very common in older adults, and that her depression stems from this caregiver role conflict. And it makes me think about how many other older adult individuals are in this same situation. On page 86 of the Ebersole and Hess book, I believe that's how you say it, the geriatric depression scale has a really good set of questions, because even though she did score on the lesser end, just on the brink of depression, it still points out that there is a problem that needs to be assessed further, because she is isolating, she is not socializing as much because of this role conflict. And so then that can open doors between the nurse and the patient to figure out if we can do respite care and help her out in that aspect. Another thing I learned from this experience is that each individual has a completely different aging process, no matter what goes into it. My grandmother, she is 85, and after doing all of these functional assessments and cognitive assessments, she is doing very good for her age. And I work for a home health agency, and they have me at an assisted living facility a lot, and I see all different ages of clients and their individual aging patterns. Each one is completely different. We have different levels of care in our facility, and there will be some 85 or younger year old patients that have no functional ability. It's complete dependence on me for doing their activities of daily living. And there will be also 85 and older adults that have complete independence and are still cognitively aware. And so on page 21 of the Ebersol and Hess book, it says for nurses to treat each patient as the individual that they are. And this couldn't be more true, because you don't want to generalize the older adults as people that are not able to do things or have the same quality of life as younger adults, because this is not true. There are 85 plus year olds, 65 plus year olds that are in better health than I am. And then there's the other side of it as well. So this was a wonderful learning experience for me, because I have seen both sides of it, how my grandmother is aging and how my grandfather is aging, and how older adults in the company that I work for are aging. So this was a wonderful learning experience. And my next question is how I will use these new skills in clinical practice. I think the skill that is a very good way of assessing functional ability is the get up and go test. This is very important because falls are a major issue in hospitals, and this is a way we can assess the person's ambulation and gait and balance overall. And this would help out a lot of nurses, a lot of techs when figuring out how able that individual is overall for ambulating. So thank you.